Now coming to the clinical features of patients with the eosinophilic esophagitis. Okay, the most common presentation is usually in the form of heartburn, right? This is the most common presentation. So because of that, GERD becomes a closely related differential diagnosis. The second most common presentation is in the form of dysphagia, right? So these patients may have difficulty in swallowing. Okay. The third presentation is in the form of recurrent food impaction. Recurrent food impaction. When it comes to recurrent food impaction, remember there are two important causes for recurrent esophageal food impactions. One is Chayefsky's ring. We are all familiar about it, right? The second one is eosinophilic esophagitis. And also remember that eosinophilic esophagitis is itself considered as a risk factor for development of Chayefsky's ring. So there is some correlation between eosinophilic esophagitis and Chayefsky's ring, right? So we should be aware about that. Apart from these presentations in the form of heartburn, dysphagia, and recurrent food impactions, patient may also present, particularly the children, right? So in the pediatric age group, they may present with failure to thrive. Failure to thrive. Another thing you might notice is they may have the heartburn, dysphagia, or the chest pain as complaints, but you may also notice that these patients may have aversion to food. Okay, so we should keep this point also in mind, particularly because the food may trigger, because see, this is a disorder which is triggered by food allergy. That is what we currently believe, right? So food may trigger the allergic manifestations. So food may be responsible for intense nausea and vomiting. That is why they may have food aversion, right? So we should be aware about this. So these are the clinical features. Particularly in adult world, we suspect eosinophilic esophagitis when a patient presents with the GERD symptoms and it is refractory to GERD. Then we subject them for the endoscopy, do a biopsy, and the biopsy report says that this is eosinophilic esophagitis, right?